The Greater West Bloomfield Community Coalition is holding a special panel discussion on fentanyl this week at the Henry Ford West Bloomfield Hospital location. Very important topic to discuss within the community, and joining us to talk a little bit more about that specific event, we have Executive Director of the Greater West Bloomfield Community Coalition, Lisa Berkey, joining the Splash Live. Thank you so much for your time, Lisa.
Thank you for having us today.
Absolutely. So what we have here is a very, very serious situation and topic within the community. But before we even get there, let's just start off with the root, the Community Coalition of Greater West Bloomfield. Can you give out more information in regard what this organization is exactly?
Sure. There are 21 coalitions in Oakland County, and we are one of them. We've been around since the year about 2000, and what our goal is to help our kids grow to their greatest potential. And so we do programming on a variety of subjects like drug and alcohol prevention, mental health, internet safety, anti-bullying, coping, resilience. Like I said, anything that's going to help the kids grow to their greatest potential. So we bring programming into the schools, and we also do evening programs for parents and community members, just like we are doing at Henry Ford this week.
Interesting. Great information to know for myself and for the community who may not have been privy to your organization, the Greater West Bloomfield Community Coalition. Anyway, so getting into the event now, it's kind of self-explanatory with what you said, but I want you to give a little bit more detail. What inspired you to organize this event on fentanyl education and prevention?
So our job is to bring topics to the community that are very important and timely. And right now, we believe fentanyl is a very important topic because lots of people are dying from it because of the buying fake drugs over the internet, or somebody just taking a pill from somebody else. And it's just that one-time use of using it that can kill somebody. So we think it's very important to educate our community from a variety of different aspects. We're having a forum of different people so people can hear the different parts of it.
Great information. And like we spoke on this briefly in other episodes on the Splash Live, where this is starting to become a growing issue and concern within our community here in West Bloomfield, or even in Oakland County in general. We have the sheriff also giving out information and doing different town hall meetings regarding the fentanyl crisis. So we definitely do appreciate your efforts and your organization effort in actually going and tackling and addressing this issue, I should say. So how does the community education help in addressing the opioid epidemic that we are currently experiencing?
So this specific event is going to have 4 different people speaking. We are going to have Lisa Kaplan from Maple Grove, Henry Ford Maple Grove. She is a social worker and has been in the addiction field for years. We'll have Dr. Jason Veter from the ER department of Henry Ford. We'll have Chief Patton, which everybody knows. And we'll have Steve Norris, who is the Director of Recovery and Harm Reduction at the Alliance, speaking. So we're going to have 4 different people speaking, like I said, from a different direction. So more of Lisa Kaplan can discuss about addiction and how to identify it and what we can do about it, where Dr. Jason Veter will talk about more of from the medical standpoint of what's going on with fentanyl. Chief Patton can talk about the partnerships that we have here in West Bloomfield to help tackle this, and how often the police are seeing something and what they do about it. And then Steve Norris will talk about from the harm reduction and recovery support aspect. So he'll tell us more about what they're doing to educate people on it so this will slow down. Another thing that Steve will discuss, and I know it's been on the Splash before, we have Save a Life boxes throughout West Bloomfield.
Right.
And in those Save a Life boxes, there are Narcan. Thank you. That's a great picture to put up there. We have We have Narcan in there, we have
Hmm.
fentanyl test strips, we have doTERRA bags, which is the eco-friendly way to dispose of unused and expired meds, and there are all
Mm.
sorts of resources in there. And I believe the box that you're showing right there is actually right at our town hall in West Bloomfield.
Good, good. Yes. And like you said, we discussed this previously before. So, yes, we have live examples and pictures of those Save a Life boxes that are around the Oakland County, specifically West Bloomfield community. Joining us right now from the Greater West Bloomfield Community Coalition, talking about a special panel discussion on fentanyl this week at the Henry Ford West Bloomfield Hospital. We have Executive Director of Greater West Bloomfield Community Coalition, Lisa Berkey, joining us talking about this. So, I want to get into it because the community is a big part of this, right? We actually need them to actually show up and participate. What or how do you ensure maximum participation from the community at this event? Will there be an opportunity for them to come and speak, ask questions to the panel? What's going on with the participation from the community there?
Wonderful. So first of all, we are advertising it through Henry Ford, through the
Hmm.
coalition, through Oakland County, through the police department, variety of ways, and doing the splash today. So
Right.
hopefully lots of people are hearing about it. So we will have hopefully a large crowd in the demonstration kitchen. And yes, the people in the audience will be able to ask questions. They can, if they don't want to say them out loud, they'll be able
Hmm.
to fill out a 3x5 card, and I, as the moderator, will ask it for them if they're embarrassed for any reason to speak out loud. The other thing that's great about our panel discussions, our speakers will always stay after to talk to people privately, because sometimes these are uncomfortable
Hmm.
situations where people don't want to raise their hand.
Hmm.
So they can pull one of our speakers aside after the event and they will speak to them at that point, or I know they all will hand out their business card and they can contact them at any time.
And that's great. That's a great way to do it. I like that you're doing it both ways. They get an opportunity to speak out loud in public, get their idea, their question, their statement out for everyone to hear. It may be something that they want everyone to hear. And then there may be moments, which we all have, where sometimes you don't necessarily want to inquire in front of everybody, the entire consensus. So, yeah, having the opportunity to pull one of the panelists to the side after the event is very, very important. An event which is also free, to my understanding. It's
Yes.
on a first come, first served basis. And you also, if I'm not mistaken, say this event may be recorded. Can you just speak on the event being recorded? Why is that part important? I feel like I know why, but I want you to explain if possible.
Unfortunately, I don't believe it can be recorded at this time, so
Okay.
unfortunately, it will not be, but thank you for asking that question. Yes, it would have been wonderful if we could have done it, but I don't believe it is, able to.
Hmm.
So that is even more reason for people to contact us and
Good
learn
point.
more about the event on April 17th at 7 p.m. and come to, Henry Ford Hospital. If they are unable to attend and they want to learn more after, they can look at our website to give me a phone call and I can connect them to any of the speakers if they have any questions if they cannot attend.
Absolutely, Lisa. And essentially, like we said, a very, very important meeting, essentially, that any and everyone from the greater West Bloomfield area would want to attend, whether it affects you directly or indirectly. Going there to get that knowledge to help yourself or others, very, very important. And once again, this event is April 17th, 7 p.m., Henry Ford West Bloomfield Hospital, the demonstration kitchen on West Maple Road. Any last words, parting words for us, Lisa? Any important information for the community before we part ways?
Yes, a couple things. One, this is our first live event at the demonstration kitchen since COVID. So we're very excited for it. And we're very
Nice.
thankful to have a partnership with Henry Ford Hospital and Henry Ford Maple Grove, the police department, and the Alliance to put together a program like this. So we're very thankful for all of our partnerships. And this is open not just to our West Bloomfield community, this is open to
Hmm.
anybody around who wants to make the drive to Henry Ford West Bloomfield. And one additional piece that I would add is on April 27th, it is DEA Take Back Day. And that is the
Ah,
day to empty out your medicine cabinets. Unused and expired meds should be removed from your home.
correct.
And here in West Bloomfield, we're lucky that our West Bloomfield Police Department will take those 24 hours a day, 7 days a week. No needles, no liquids, but all medicine
Hmm.
besides needles and liquids.
Hmm.
And on DEA Take Back Day, it's just the day that we advertise it.
Right.
And the West Bloomfield Police Department is waiting for you to come on in and bring everything in. But like I said, in West Bloomfield, we're lucky to have it at any time. The Orchard Lake Police Department is also participating in DEA Take Back Day. So they'll be
Hmm.
available on the 27th from 10 to 2 to take back your unused and expired meds.
Great information, Lisa. Thank you again for providing that. Perfect place to land. Also, we will have more information in regards to that DEA drug take back program going on later on. Thank you again. Joining us, Executive Director from the Greater West Bloomfield Community Coalition, talking about the special panel discussion this week on fentanyl at the Henry Ford West Bloomfield Hospital. Lisa Berkey, thank you so much for your time.
Thank you for having us.